We're going to do passive range of motion of the left hip in a supine position. I'd like to talk about the bolster or the support for the right leg here only, because we don't want any support underneath the left knee. I'm just going to show quickly that the bolster or the pillow is only supported the right knee, not the left knee, just to have more range when we move the hip. Now that the draping has been completed, we can do the passive mobilization of the left hip joint. When you move a leg, it's much easier to move a leg that is flexed at the knee than a leg that is straight, because a leg straight is way heavier than a leg that is flexed, especially when it's nice and muscular. Okay? So my center of gravity should line up with the joint that you're moving. In this case, it's the hip joint. My legs are nicely spread, so I can move from right to left in a safe manner. And now, flexion of the hip. So I'm going to just grab the inside of the knee, grab the foot, and then bring the hip into flexion. Okay. Bring the hip into flexion. I adjusted my stance so I can be more comfortable in holding the leg. So that's flexion. And that's how far this client can go in flexion. Okay? So you need to be mindful of what's stopping the movement. Okay, that's flexion. And the return is extension. Flexion and extension. Okay? Then the next movement we're going to do is horizontal adduction and horizontal abduction. Let's see how the client can let go. Here we go. Horizontal adduction and horizontal abduction. Okay? Now we're going to do rotation. So the knee needs to be stacked above the hip. We have a 90-degree angle. Okay? Now I'm going to bring the foot in to laterally rotate the hip joint and then medially rotate the hip joint. So that's lateral or external rotation, and this is medial or internal rotation at the hip. Then we could combine all movements here to do circumduction of the hip. Okay? In the other direction this time. Okay? Okay. And bring the leg back down. So this is passive range of motion at the hip, can be incorporated into your massage, can be done before, during, or after your massage, highly needed with aging populations since the hip joint is the fastest aging joint in the body.